Once again, karibuni sana to those joining us. We're just taking 2 more minutes to allow anyone else joining to join us so that we can just kick off together. Betty, we see you. Karibu sana. Okay, it's 3:35. I think we just start promptly. I would like to invite Evelyn to begin with us, to begin for us with a word of prayer, and then we'll go on from there. So Evelyn, karibu, and just open for us with a word of prayer.
Thank you, Carol. Let's pray. Baba wetu, katika jina la Yesu, tunakushukuru jioni ya leo, tunasema ni asante. Asante kwa maana umekuwa baba mwema, umetulinda tangia asubuhi. Umekuwa nasi mchana hadi kufikia masaa haya. Umeweza kutupeleka sehemu za mbali, sehemu za karibu. Baba, tunakushukuru, tunasema ni asante. Asante kwa kila mmoja ambaye umemhifadhi, umekuwa pamoja na yeye. Baba, tunataka kushukuru kwa wema na fadhili zako, kwa ulinzi wako, kwa sadaka uzima, kibali hata neema ambayo umeweza kutupa kufikia masaa haya. Tazama Baba, tumekusanyika pamoja katika kusanyiko hili webinar ambao tunataka kuzungumzia ni kwa ajili Autism Awareness, Mfalme wa Ajabu. Kabla hatujaanza, tunaalika nguvu zako, tunaalika mapenzi yako Baba ishuke, ukatutawale katika kila kipindi, ukatutawale Baba, utawale wote ambao wanaingia, wasikilizaji, watazamaji na hata caregivers ambao wanataka kujiunga pamoja nasi. Naomba kwamba ukatushukia, ukaachilie Roho Mtakatifu awe pamoja nasi katika mazungumzo haya. Naamini ya kwamba Baba, kupitia katika webinar hii, Mfalme mwema unaenda kuleta mabadiliko katika jamii hizi ambazo zinapitia hali hii ya watoto ambao wanaishi katika hali ya autism wakiwa na caregivers ambao ni wazazi wao. Mfalme wa ajabu, mafundisho yote ambayo tunaenda kujifunza, naamini ya kwamba itakuwa ya baraka, itaweza kuimarisha jamii hizi, itaimarisha hata familia hizi. Hivyo basi tunaomba ukashuke, achilia uwepo wako Baba, ukaweze kufunika internet, ukatawala network zote, ukaachilia ulinzi wako, kwa maana wewe ni Bwana. Baba, nimeomba machache nikiamini kupitia kwa nguvu za Roho Mtakatifu, katika jina la Yesu nimeomba hasa nikiamini. Amen. Amen.
Amen. Thank you so much, Evelyn. We do appreciate starting us off with a word of prayer. And so it's yet another opportunity. Today we want to learn about augmentative and alternative communication as we raise awareness on autism. The backdrop to this is that some of our children on the spectrum, we have those who have speech delay, we have those who are non-verbal, those who are pre-verbal, and those who are actually verbal, they can also benefit from this. But our focus for today is mainly those who have speech delay, those who are non-verbal, and pre-verbal. What can we do? Is there a way we can have functional communication with our children? We know that there is speech therapy, and beyond speech therapy, what else? How else can we communicate with our children to avoid tantrums? You know, so many tantrums and meltdowns. So we are privileged today to have with us a very rich panel. I would say we have Mr. David Methu, who I'll be introducing just before he comes and starts speaking to us. And we also have Esther. Esther Odongo is a sign language interpreter. She has actually worked with children with special needs, more so on the spectrum. So she will be sharing her story, her experience on how the journey has been. And I am your moderator. My name is Caroline Wadhege, and once more, karibuni sana. As we start off, I would like to share a small clip on what autism is for the benefit of those who may be joining us for the first time, and probably this is your first interaction with autism. So just to start from the point of the known as we move to the unknown. And I hope we will all learn something together. Feel free to ask questions. We hope it be as interactive as possible. So I'll share my screen so that we can all benefit from this. Just a minute. So this is a video on what autism is, so that we are all on the same page. Enjoy the watch.
Well, a quick explanation is that autism. Hello, I'm Dr. Meg Stone Heberlin, a licensed clinical psychologist at Cincinnati Children's Hospital Medical Center, and you're probably wondering, what is autism? Well, a quick explanation is that autism spectrum disorder, or autism for short, is a term that describes a variety of developmental differences in social interaction, communication, and behavior. The autism spectrum represents a diverse group of people with various skills and interests. For example, some people with autism can speak fluently, while others may have difficulty communicating. Some people with autism might communicate using pictures or devices. Research suggests that autism develops from a combination of genetic and environmental influences. These influences increase the risk that a child may have autism. Factors that may increase a person's risk for autism include family history of autism, advanced parental age, pregnancy and birth complications, and pregnancies spaced less than 1 year apart. However, keep in mind that risk is not the same as known cause, and there is no known cause for autism. Diagnosis comes from a medical doctor or psychologist after evaluating a child's developmental history, social interaction, behavior, social communication skills, and developmental or intellectual skills. Direct assessment and caregiver report are both important components of comprehensive autism evaluation. Autism can be detected as young as 18 months of age. The American Academy of Pediatrics recommends routine early screening by each child's primary care doctor because early detection and intervention lead to improved outcomes. Autism symptoms can vary from one person to the next and may present as difficulties in the following areas: speech and nonverbal communication, making eye contact, understanding facial expressions or other people's feelings, playing or engaging interactively with peers, initiating pretend or imaginary play, sensory processing, including sensitivities to sounds, touch, or movement, flexibility, and adjusting to changes in routine. For example, some individuals with autism show a strong preference for routine or repetitive behaviors, or a tendency to hyper-focus on topics of interest. People with autism also have many strengths that are unique to each person, but might include learning and remembering facts, events, and stories, visual problem solving, like doing math problems, puzzles, and figuring out how things work, following routines and schedules, thinking about the world from a different perspective, leading to innovative and creative ideas or solutions to problems. The three most common myths about autism are: people with autism don't feel empathy or emotion. This is not true. In fact, people with autism have empathy, emotions, and feelings. They may just have a harder time showing their feelings or will demonstrate their emotions differently. Another myth is that people with autism can't handle change. That's not true either. The reality is, predictable routines and structure help all people feel safe and comfortable. Change can cause anxiety for anyone. People with autism may be more likely to perseverate or get stuck when something unexpected happens. Preparation, planning ahead, and time to adjust are 3 easy tools that can help people with autism cope with change. And the last one is people with autism are not interested in having friends. Nope, that's not right. Children and adults with autism are often very interested in interacting with their communities and making friends. Just like everyone else, people with autism have a wide variety of interests and talents and particularly enjoy connecting with others with similar experiences and interests. So remember, autism affects the development of social interaction, communication, and behavior. No 2 individuals with autism are alike. People with autism have different strengths and challenges, just like all people. This is why it's called autism spectrum disorder. Some factors that may increase the risk of autism have been identified through research. Just because a factor has been associated with an increased risk of autism does not mean that it causes autism. More research is needed to understand the causes of autism. People with autism have many strengths and view the world from a different perspective, adding rich diversity to our world. For more information, go to cincinnatichildrens.org and search for autism. A message from Cincinnati Children's.
Okay, thank you. I think we'll stop it from there. Let me just switch that off. Okay. So now we have the background of what autism is. Sorry about that. We have the background on what autism is, and now we can move on to the topic of the day. And I want to invite Esther, who's here with us, to just share her story, to just tell us how her experience has been teaching children with special needs, more so autism, sign language. Is it possible? Do they learn? What factors should caregivers, put in consideration in just finding, functional communication with our children? So Esther Odongo, you're most welcome. I'm handing it over to you.
Thank you, Carol. Thank you so much for this opportunity, and I hope you can hear me.
Yes, we can.
Okay, thank you. So my name is Esther Odongo, and it's a privilege to just come and share my experience with how I interacted with children with autism when I used to, of course, I interpret sign language, and I also teach. So I was teaching in a school that was inclusive. So that's meaning that we had children with autism and other special needs like the deaf. So at first I was specifically teaching children who are deaf, those who are not able to speak. So that was just specifically sign language. But because it was, there was integration, I had to move around all the classes so that I get to also teach other children who are not deaf, but have other, let's say, have other disabilities. And so I would also go to a class that we had children with autism, and I was required to also teach them, because normally what would happen is that they would interact with other kids whenever they would play outside, or even just interact with anyone around them. And so it was important to at least just teach them something so that they're able to communicate with others. And so when I would go to their class to teach, my experience was that I realized, because initially before I didn't know that they would get or understand sign language. But as I kept teaching and I kept interacting with them, I realized that it was very possible that they would understand and they would even enjoy. And so what I would do, I would really take time with them for teaching kids sign language who are autistic. I would mostly use like pictures and charts to show like whatever I'm trying to, for example, whatever I was trying to teach, like let's say something like eating, sign language for eating. So I would show them, but at the same time, I would show the picture. And so they would learn faster like that. Like they would see the picture and then they also see the sign that I was doing. So I realized that the kids who are picking it so fast, and then there are those who are taking some time before they pick, but again, they would pick much later. So another thing I realized was that I would repeat like whatever I was teaching instead of continuing to teach other things. Like I would keep repeating that which I had taught before so that they get it and understand it better. So for example, if I was teaching whatever I've just mentioned, like eating, I would go back again and show, even have time with them when they would, for example, even have lunch during lunchtime, and I'm in their class, I would show them and use the sign. So I would say the word eat and show them now they have their food, and I show them whatever they have there, they're putting into their mouth, they're eating. And so I realized that it was possible that they were able to catch it. Another thing that I also realized is that the kids really enjoyed music. Like I remember we'd have a time for assembly on Mondays and Fridays, and all the kids plus their teachers would go to the assembly square, and before anything happens, would like sing songs, and I would interpret the songs that we would sing, and I would see them repeating the signs of the songs that we were singing as I showed them the signs. And I realized that they were really enjoying, they were dancing along and repeating some of the signs. And so when I would go to teach their class, I would still sing along with them. And then as I show them the sign, as we repeat the signs, the same songs that we kept on like singing during assembly. And that would be easy for them to like catch the signs. Then something else that I realized was that apart from autism, there were other kids who have like, you'd find other kids with autism, and then maybe cerebral palsy in the same class. And I realized that for those kids, it was a bit hard for them to like make the right sign, but you'd see that they were making at least a sign that was almost the same as what I was showing them. So for those kids, I would not like force. I would just like show them the sign, and also help them hold their hand and help them make that sign. But if it was not like 100% possible, then I would let them do that which they were able to do, because it was almost the same as what I was trying to show them. So those are some of the experiences that I went through when I was teaching the children. And something else, when I was not generally teaching sign language, I think we used to really encourage their parents. Even for the deaf, we would really encourage the parents to at least learn basic sign language, because sometimes we realize that some of the challenges that we were facing was that after the kid has learned the language in class and interacted with other kids in school, then when they come back the next day, they would forget. Why? Because they didn't have anywhere to practice those signs. Like maybe back at home, they didn't have anyone to show them that, your teacher taught you how to do the sign for eating. So this is how you do it again and again and again. So I think that's something that we used to encourage the parents, that it's important to also learn the language so that you can always communicate with your child. You know what they want at that particular time. If they show you something like eating, then you're able to understand that this is what my child is trying to show me, or this is what my child is trying to communicate. So those were my experiences. And I think, I don't know if I mentioned something like, we would also really be patient with them when we were teaching, because I also realized something else, that when I was teaching the other classes and also teaching those who are deaf, then it was easier for them and very fast for them to catch it. But when I was in the other class for autistic children, I had to be very patient with them. Sometimes I would think that they were not going to get it, but finally they would get it. So I think being patient is also very key when you're trying to communicate with a child with autism using sign language. So from my experiences, I think those are the things that I would share from what I learned and from how I saw it when I was interacting with them. Back to you, Carol.
Okay, thank you, Esther. We appreciate your insights. I think I want to give our participants the floor if anyone has a question on that. And as that is happening, I just want to capture what you've said. One, from generally, it is possible to teach a child with autism sign language. Two, a lot of patience when you're doing that. Parental involvement, the use of pictures. I'm just summarizing what I've heard you say, so that even as a caregiver, listeners can know, okay, so this is what to expect. And also that you'd go with the pace of the child. I hope I've captured all that correctly, Esther.
Yes, you have.
Okay, thank you. Thank you so much for sharing your experience. Is there any caregiver or any participant who would have a question for Esther? Matters sign language. Okay, Mama Selvin, we see you. Yes, we are recording. We are recording. Yes, Grace, please go ahead. I see your hand is raised.
Thank you very much. Good afternoon, everyone. I'm happy to be here. I have a question for Esther. I wanted to ask Esther, is there an age limit for, let's say, an autistic child to teach them sign language? Is it earlier? Is it better to start when they're young, or maybe, for example, they have grown big, they may be into 19, maybe 15 thereabout, and maybe that's a reason, maybe at that point the caregiver wants them.
Thank you, Grace. Thank you for the question, and I think it's an important question, because I forgot to share the age that I was teaching. So while there, I was teaching age between around 4 years, I think, to about 7 years. And so while teaching the sign language, I realized that it's actually important if they start at an early age. Like, it's easier for them to pick up that way, for them to pick up so fast, so that as they go along, they're able to always use that which they've learned to communicate around with people around them. So I think it is very important. Like, it was easier to, you can start teaching at a younger age. You don't have to wait for a kid to be like 15 years or maybe older. It's easier when you start at a younger age. That's what I realized.
Okay. Thank you. Grace, I believe are you okay?
No, sorry, my phone hanged. I don't know. I didn't hear anything. Kindly repeat again. My phone has some issues. Sorry.
Sorry, Grace. Yeah, so I said, yes, it is possible to start at an early age, because while I was teaching, I just mentioned that if I can remember well, I was teaching about 4 years, from 4 years to around 7 years, and it was easier for them to pick up like that. So it's actually important to start at an early age and not wait for them to be way older. Yeah.
Okay.
Okay, thank you. Thank you.
I hope, did you? Okay.
Thank you, Esther, and thank you, Grace. Esther, we have another question for you. When can we know that we need to introduce sign language to a child?
Wow. Do I really know? Because, okay, well, for me, the class I was teaching, I think they were already, the kids already had been already taken for, it's called what? Like for checkup and all that. And so for me I was just required to now teach them. So I don't think I have really an exact answer for that.
Okay, we hear you, Esther. I think
Yeah.
we will also pass it on to Mr. David Methu to also help in answering that when we are coming to him in just a short while. And then where can we as parents and caregivers learn sign language?
Well, there are institutions that teach Kenyan Sign Language, like Kenya Institute of Special Education, where I also did my studies. There are also, I think, also people who are well trained in Kenyan Sign Language. You can also tutor. I used to also tutor, and I still do it. So there's so many. You can go to institutions if you like. If you like, you can ask someone who is well trained and is certified to teach you the language.
Okay.
Yes, yeah.
Thank you. I'm just about to close that now. If there is any other, this is the time. Thank you for those questions. So just keep them coming. I want to bring in our main panelist. Thank you, Esther. So I want to introduce Mr. David Methu to us. He's the founder and chairman of the Society of Augmentative and Alternative Communication, the Kenyan chapter. He's also a member of the International Society of Augmentative Alternative Communication. He will tell us more about it, and special educationist. I believe he has also a large a large experience. Please, Mr. Methu, tell us more about yourself, and I would like to welcome you. Karibu. Kindly unmute.
Yes, good afternoon, everybody.
Afternoon.
Can you hear me now?
Yes, we can.
Yes, you can. Thank you, Caroline. I am David Methu, like Caroline has mentioned, and my background is special education. And I like to say it has been quite a long time in special education, because I think I entered into this field, I entered into this field in 1989, actually having trained for 2 years at the Kenya Institute of Special Education. From there, I worked in an assessment center. We have the Nakuru Assessment Center for some spell. Then I went into a school called Nakuru Hill Special School, where I ended up being the head teacher. And now I am a retired teacher from teaching service. But just before I retired, I had begun to teach on part-time basis. One at Kise in their distance learning programs. I have taught in Mount Kenya University, Presbyterian University, Laikipia, mainly in Mount Kenya University and Presbyterian. I was teaching in the area of special education. And I also teach some management courses. So apart from that, I have always gotten interested in the development of special education. And one thing that gave me an opportunity to be able to get into that is the fact that I've been a panelist at the Kenya Institute of Curriculum Development since the year 2002. And then so that even after I left public teaching service, I was able to get engaged occasionally now from the point of view of the fact that I was teaching in universities. I got engaged in developing the CBC curriculum in the area of what they refer to today as stage-based curriculum. And I must say that is one thing that really excites me, because for all the time that we were there, we always said we needed something to guide the teacher about what to do with the learners who may not be able to follow the regular curriculum. Of course, when I'm talking about this, I don't mean the hearing impaired or the visually impaired or the physically handicapped. I mean those with intellectual and related disabilities like autism, severe cerebral palsy, and so on. And so when the development of CBC started, it is good that through some very well thought out initiative by some of our colleagues who have worked in the department there, they came up with this department this curriculum line that they call the stage-based curriculum pathway. And I must say, while they engaged me, I got so much involved in the area of communication skills. And that is how I landed into thinking about augmentative and alternative communication. So apart from that, I have an interest in the development of parents groups, because I feel, particularly with the children we are talking about, the parent is very key. And that is why I am excited about you people who are caregivers, the parents, who are able to come together in an initiative to be able to pursue services for these children and for these persons. Let me say, because we don't only talk about the children, we should think about everybody. So in that connection also, I'm running a small program in Nakuru of adults who have who live with intellectual and related disabilities, and that includes autism. And what we are doing is, we are dealing with those ones out of school there for 18 years and above, and they come together, they learn skills. We are giving them skills in financial literacy, communication, because even while they were in school, it never would end, because they really need to keep growing and so on. So I am the chairman of a society called the Society of Augmentative and Alternative Communication, which we registered in 2019. Although after the registration, we had not very many activities, but we have done quite a great deal here and there because we were able to get some support from some teachers who worked in Nakuru Hills with me at a certain time, very early in the 90s, who had come from Denmark, who gave us support to train our teachers in Nakuru Hills, and also some teachers in a sister school in the same town, all in Nakuru. And this is a total of 13 teachers who got trained in what is called augmentative and alternative communication. And let me say, just got the basics of augmentative and alternative communication, because this is a very wide, it has a very wide scope. I think I was doing the introduction, Caroline. I don't know. Looks like I've already gone into talking about AAC.
Yes, thank you. Thank you for that. Yeah, please carry on and just let us know what is AAC, and what you've prepared for us today to learn about it and how we can, implement it in our homes.
So AAC is the abbreviation for augmentative and alternative communication. You see there are two words here, augmentative, and the other one is alternative. Augmentative in the sense that it is supporting something that actually already exists. Alternative, because it may go to areas where nothing exists, and therefore we have to look for an alternative to communication. So for instance, when somebody has some residue speech, they can be able to verbalize certain words and so on, and perhaps we can be able to make out something out of it. But then it is so labored that it takes a lot of time for us to be able to get it. Then we need the augmentative aspect of it, because we want this speech to be supported so that the person can be better understood or quicker understood. If there is no speech completely, then it means that we look for an alternative of that they can communicate in. So in our Kenyan situation, we are concerned about those children, like I've said, who are, or those people who are addressed by the stage-based curriculum. Of course, the curriculum addresses school-going children, but everybody who is in that population is the one that we think about, because we are aware that sign language has done very well. It is an aspect of augmentative and alternative communication, but the population who use sign language, mainly the hearing impaired, I would say they have made great milestones, because that's why you see even our television stations and so on are able now to cater for them. But then we thought, when we were beginning this, that how about that person with cerebral palsy, or that child with cerebral palsy, that one with autism, that one with intellectual disability, that also has difficulties in speech. How about them? And we said these people have not been included, even as we talk about inclusion. And that is why we thought aggressively to address their plight in terms of their education, and of course, even outside in the community, how do they communicate? We have, so when we talk about augmentative and alternative communication, we it is generally classified into two categories. We have what is referred to as the aided augmentative and alternative communication. And then we have what is called the unaided augmentative and alternative communication. The unaided augmentative and alternative communication includes gestures, signs, signs, not necessarily the conventional language, it's Kenya Sign Language, but we all use signs at certain points in time when we are talking and things like that. So our gestures, our body language, anything that does not use any form of technology, and that is using our body language to be able to communicate, is what is referred to as an aided augmentative and alternative communication. Do we need to think about unaided alternative and augmentative and alternative communication? Yes, we need to bring ourselves to be sensitive to that, because many times most of us in the population do not think that our body language is such important when we are dealing with somebody who has a speech or communication difficulties as such. So when we never use our body language deliberately so that they can be able to get what we mean or what we want or what we are addressing them about. So if you look at the curriculum, the stage-based curriculum, you realize that the communication skills area begins with non-verbal and verbal communication, non-verbal communication. And we are talking there about signs, we are talking about gestures, we are talking about all the cues, body cues and things like that. So we need to think about it deliberately, because if we just assume that everybody is like us and therefore they are not as important, because even as I'm talking now, you can see I'm using a lot of gestures. But for that person who has speech and communication difficulties as such, they are very important. The eye contact is very important. So for us who handle children with autism, for instance, you realize that body language is very important, because like Dr. mentioned at the beginning, their integration of information is so much visual. They want to see things. And so the way they see you is very important. The way you communicate to them, your eye contact, the way, whatever body language you have is very important for them, because they get cues about what you're saying. I mean, what you're trying to, what you're implying from that. So, and that is why in the area of special needs education, we would like to encourage people not to take for granted the issue of unaided communication, like through gestures and so on. That body language is very, very important. So that is one category. The other, the aided, means we are using certain aids to help in communication, and this is where we use things like communication boards. I'm sure this is not a very new thing to us. Communication boards and any other device that we may use, including today, if you go into delve into the area of augmentative and alternative communication, you find that there are so many gadgets that are being developed, particularly in the developed world, where they're using IT, computer technology to be able to communicate. And this is where we talk about the aided augmentative and alternative communication. Now, coming to our case in Kenya, because we haven't gotten there about because of the question of resources, and then of course we are just beginning. We came up as we were developing the we were thinking about augmentative and alternative communication in our curriculum. We thought about this that had been taught to the teachers in Nakuru by our friends from Denmark. And so what we did is I personally requested KICD to allow that they make a presentation at the KICD so that they could see what we had learned, an aspect of augmentative and alternative communication that is aided, whether it could be taken into the curriculum so that everybody can start learning it. And from there, then we can, of course, in future, hope to even develop further. So this presentation was made, and happily KICD said, yes, we need this. We need this because there are learners surely who are just left without much attention in the classes just because the teacher doesn't know how to communicate with them, because they can't use language, sign language, because of their nature of disability. For instance, if you take those with severe cerebral palsy, they won't be able to go through the motions of the signs. Those with autism, because they have other characteristics that may hinder them into really grasping the whole motion of using sign language. They need something that is going to be captivating in another way that is going to help them articulate their feelings, their wants, their needs, and so on. And that is how we have augmentative and alternative communication in the curriculum. So this choice that we made, and I said it was introduced to us by friends from Denmark. In this choice, I would like Karen, please let's see, go to the slides now.
Okay. Have shared. Can you see them?
Yes, I can. Can everybody? Yes.
I think we can all see. If not, kindly just let us know.
Yeah. Okay. So just before I go into them, you realize here we are talking about communication boards, and people have many forms of communication boards that are pictorial with symbols like the ones we have. But in our particular focus, we have what we call the core word board. And this is what you can see on your screens now. Why we are saying it is our focus. If you go to the internet, there are so many people who have developed symbols, pictures, etc., that are used in augmentative and alternative communication. So if you just Google augmentative and alternative communication, you will see lots of these things. Certain sites are even free. You can download them and use them as much as you want. Now, it is the same thing that we have followed. But what we are saying in our situation is that we need a core word board. This is a principle that is that has been studied by people who are studying the area of augmentative and alternative communication. That there are words that are so commonly used by everybody that they are so important to all of us. And these are words that we use in our everyday life. So the core word board contains symbols that stand for words that we use very commonly in our everyday life. And if you look at that board, you realize that there are several colors. Just a minute, I would like to check on something here. Okay, let's go on. So the core board, I have said, contains those words that we most commonly use. And through research, it has been established that these words that you find on this board are the most commonly used. I'm calling them words because if you look at the board, I don't know whether you can be able to enlarge it, Caroline. I don't know. Yeah, if you look at that board, there are some words beneath it which tell us what the symbols stand for. So, this board has those very common words that are basically used by children, except the nouns. So in this, we have all classes of nouns. We have prepositions, we have verbs, we have adjectives in here, but we do not have the nouns. And the reason why we don't have the nouns is that nouns are everywhere. It is anything that you can point at. So, using these symbols, the individual is able to make a sentence. I think if we had a bigger screen, I think we would be able to see. If you look at the first, the blue ones, what are those? You have I, me. What do we call those ones in the parts of speech? I, me, you. Hello, are you there?
Yes, yes, we are there.
Yeah. So those ones are pronouns. They are pronouns. If you look at the red ones, you have the verbs. It may not be very clear, but what we are saying is that every class of words is there. And when we are looking at this board, we shouldn't think in terms of the English. So if that symbol I stands for I, it is standing for I in Dholuo, I in Kiswahili, I in Latin, I in German, and so on. So what we are saying, this board can be used by anybody in any language to make sentences. Like if you take the one symbol, the blue ones, you take the one I, and then point at another one. There is want. Are you seeing? Can you see my cursor? Hello?
No,
Can you see my cursor? Yeah,
okay.
yeah.
Yes.
Yeah, that first one.
Yes.
I just want to give you a simple one. This is this symbol here. Can you see the two hands raised there? The two hands raised as if somebody wants to receive something.
Yes.
Yeah, that is want. So the person can use that simple point at that first one, I want, and then come to the red one where you have got the verbs. The first red one there is to drink. I want to drink.
Wow.
Are you seeing the cursor? I.
Sorry, Mr. Medu, maybe you could screen share yours so that we can follow.
Mhm. Oh, sorry, lost.
Mr. Meadow,
Yes.
I could stop sharing my screen so that you can share yours and we'll be able to follow.
Mm. Yeah, let's see how we go about it.
Okay. So I'll stop sharing mine so that you can share from your end. Is that okay?
Yeah, I hope I get there.
Okay. Let me guide you. Let me stop sharing.
Yeah.
Then on your screen, there is share screen.
Mhm. Share screen.
Yes, towards the bottom.
Mhm. I am lost. I can't see that.
All right. Sorry, perhaps then you will guide me where to go so that I do not confuse.
Yeah.
Okay, then let me share again.
Let's go back to the slides here.
Okay.
Can you please enlarge it?
Okay.
Hmm.
Let me just.
Oh, I think go back to the format you are in, because I think I am I'm lost a bit.
What about that?
Yeah, that's a bit better, but still small. Let me see. Show the option. Let me see.
Okay. Alternatively, let just a minute. Let me just.
Yeah. Mhm.
Will this help?
Mm. Yeah. But I would have wanted to see the slides the way they were.
Okay. I make it.
If we could see the whole board, eh?
Okay. With the picture.
The whole board, yes, it would be much better.
Okay. Let's just pick the former one.
Just pick the former.
So this is the original, the first one, when it's
That's
not
the
enlarged.
first. Hey.
Sorry.
That's the first one.
Yes, this is the first one, without
Okay.
enlarging it.
Without enlarging it, okay. Let me try to go to. So this is.
Are you able to see it from your end? Are we all seeing it?
Yeah, I'm seeing that. I think. Yeah. Now I'm able to see it. Yes. Able to see it. Yes. Okay. So I think we better go on with that one, and then perhaps we see what we make out of it. So what I was trying to say is that the symbols there are in colors, and the colors stand for the parts of speech. And of course, parts of speech are in every language. It doesn't matter whatever language in the world. And so the same board could be used anywhere in any country. This, I must say, is something we have picked ourselves as Kenya, such that we would like to have a standard board. Standard in the sense that if people learn to use this core board in Kisumu, they can go and communicate using it in Mombasa. They can go and communicate using it in any other corner of Kenya. Something I want to say about the cohorts. I don't know whether anybody has got any question about what we mean by the cohorts. Any question about cohorts, what they are? Hello, are you there?
Yes, we are there, waiting for any reaction from our participants.
Yeah.
I think we can move on, but the questions will keep coming as we move along.
Okay. So I think it's clear about the cohort. So we have one board, and that is when if you go to the syllabuses, this is what you will find. The symbols are the same, and we would like everybody to learn the same symbols. This core word board, I said would not have the nouns, because nouns are all over. And nouns come depending on the situations that we find ourselves in. I'm still having issues about navigating. Okay.
Susan?
Let's go to the second.
Okay.
So that explains the 50 words we all use the most when we communicate. Every word class is in there. I already said that. Every word has its corresponding symbol. Useful words for every situation. And this board is useful for all people, not just learners. So I think that one I've already explained. Let's move on to the next one. It says the individual learner can have his own additional words, e.g. nouns and names of the family, because those ones we have said are all over and depend on the context in which the person finds themselves. The next one, how to use core word boards. It is saying how to use core word boards and theme boards. It's that we need to model. Model means that if, for instance, you have your learner with or your child with autism, they need to see you making sentences with that board as much as possible. Give them every opportunity to speak using that board so that they make those sentences using that board. So model, that is where we have got a lot of exclamation marks there, because we are saying modeling is very key. Use them as often as possible. Symbols only make sense in meaningful actions. The actions, meaningful contexts in which you do things, use those symbols. Always take the initiative and show the learner what the symbols mean. Use the boards when you communicate. It says there, be investigative. That means as you are using the boards, make sure you also are in contact with the person, because you remember we said that body language is very important, what we refer to as the unaided communication. So the boards are not to be used exclusively on their own. You also take care of the body language so that you understand if this person is trying to say something. Maybe it is not coming out very clearly using the board. Can you be able to get it from the body language? So we need to integrate all these things. Let them keep trying and be patient with them. Because one thing that lacks with us is patience. We are not patient with them. For instance, they would have difficulties in going through the motions of pointing at the symbols as fast as we can. How much patience do we have about that? Or are we going to be just telling them, si hapo, ni hapa, this is it, and so on, in a way that they feel that they have a lot of deficiency? So we need to be patient with them. Come down to their level. Come down to a point at which you can get eye contact. For instance, those with autism have problems with eye contact, which is very important if they are going to get any information from the body language. But you need to be patient to be able to get that gaze from them. Because if there is no patience, then it means you will never get to in touch with them or to communicate with them. So always be curious about what they would want to be communicating, because as they use the board, that's where we are saying augmentative. Augmentative means they may be having another way of communication, but how do you couple that with the board so that you can be able to understand them better? So you don't just rely on the board such that you rely on just that sentence that they make, but you rely also on the body language, rely on their eye contact so that you can be able to get them, to understand them. And a lot of practice is therefore needed. Always be patient. It takes a lot of time for them to make those sentences using the boards. We have to be patient as much as possible. The next one. Now, there is something that has come up there called the theme boards. Theme boards. You're saying that core boards could be used with the theme boards. I think the word appeared yeah. Is that there? Yeah. How to use core boards and theme boards. What is a theme board? Because I've been talking about a core board. A theme board, just from the term theme, means that it is used for a certain context. For instance, when somebody is in the hospital, they are in a certain context. When somebody is in the dining room, they are in a certain context. They want to eat and all those things. It is time to eat. That is a different context. So theme boards contain symbols that depict a certain thematic situation. They could be theme boards about the hospital, they have said. They could be theme boards about the kitchen. They could be theme boards about a certain game or things like that. So theme boards can be as many as situations arise. We have said that the core word board will be just one. What we are pursuing is that we shall just have one core word board. The only difference is if we develop a bigger core word board, because as experiences grow, we may find that there are certain words we need to incorporate. What I have said that the core word board we have put on the screen here is for children up to a certain, and when you talk about children, of course, we are talking about even the teenagers that we have who have autism and the others. But as they go out, perhaps their vocabulary grows, and we may need to make the core word board a little bigger. The theme boards, what I'm saying is that they are contextual. That means they hold symbols about specific things. And for instance, we could have a theme board that stands for the kitchen, like I've said, the sitting room, the hospital, a certain game, whatever context, the classroom, and all those things. Let's go to the next one. And this is, the boards should follow the learner to their home. Yes, with AAC, we say these boards should accompany them wherever they are. At home, in the school, in whatever situation they are in. Maybe they are going to a certain place where they often go, maybe for certain recreation. The theme boards should be there. So, I mean, the boards should be there so that they can be able to communicate with them. We're saying they should be hanged on the walls. They should be in every place, on their tables and things like that. And I think people have expressed that this could be a bit of a bother because you have to carry boards here and there and so on. But this is something we shall be also talking about. Although I want to say at this point that as technology develops, we have seen that in certain countries, they are not using the paper boards the way we have them ourselves. They are using iPads, tablets, and they have these boards there. They are smaller things. So if boards can be developed even on even a phone screen, kind of a tablet, kind of, then it could still suffice so that everybody is everything is compressed in a small context. Let's go to number 6. These are some of the sentences that they would begin practicing in, like I want to drink, like I was giving you that on that board, although you didn't see that very clearly. I want to drink, wait for me, things like that. These are things that we say quite oftenly. And this can be used for practice. Unfortunately, in this presentation, we won't be doing any practice about this. And I want to say at this juncture, I had told Caroline that what this talk would be about is getting us to think about whether we can get our people who have already been trained in AAC to come and physically train us. If there can be that opportunity, to much better, because actually it is quite a difficult thing to do on a screen online, because we need to be together. We need to interact with these boards. We need to see the body language. We need to see how the motions go. So those are just sentences that they can be able to make using those boards. The other one. Our number 7 is theme boards. Theme boards are used in situations with more specific activities or topics of conversation. For example, if you want to talk about your family, play a game, I've said, and it can be used in combination with the core word board. It can be used in combination with the core word board, because theme boards in most cases will contain symbols that stand for nouns about a certain activity. And therefore, because we said the core word board does not have nouns, then it can be used alongside the theme board so that you can complete the sentences. Because if you are saying, I want to drink what? Maybe you have a theme board about fruit juices, and therefore you make the sentence using the core word board. That first phrase, I want to drink what? Maybe orange juice, and that could be found on a theme board that has got symbols depicting different kinds of juices. And you can see, if you have something like that at home, it would be possible for your child, or for your person with autism, or for your person with severe cerebral palsy, to be able to point out what they really want out of a certain theme board. If it's about, it is eating time, what do you want? Maybe you can have a theme board about different kinds of food. So they can use the core word board to start appropriating the sentences, come up with the phrases, and then they end up with the noun that they will find on the theme board. Although I must say at this point also that in theme boards, we also try to put some of those symbols in the core word boards there, those ones that we feel as much as possible be used in the context of the theme board. Zitatumika katika context ya hiyo theme board. Kwa mfano, the symbol for I, of course, if they are going to be talking about things in the kitchen, most likely they are going to begin with, I want this. And maybe we may have the symbols for I and want and so on. But what we're saying is that a theme board will contain those specific items that are found in a certain activity or context. The other one, sorry. Get me back. So we should remember one thing, that AAC is not learned, it's not an easy thing. it is learned through broad experiences. There should be multiple repetitions. And we continue building on the vocabulary, and particularly the vocabulary that we put in the theme boards, because the more the experience areas that the person goes into, the more theme boards you require. But we are saying, I keep repeating, that we want to keep the core board as one board so that we can be able to use it with every person from wherever, from whatever point of place that they would be in the country, in the schools, at home, and things like that, so that we can say we have a language that is a language that everybody can use. If you look at sign language, in the past, what I can recall is that before Kenya Sign Language was developed, people used different kinds of signs depending on who had introduced signs to them. For example, there were signs that were predominant in Machakos. If I'm not wrong, for those with in the area of hearing impairment, we used to be told that Machakos had most of the introduction on sign language done by the Americans, and therefore there was a lot of American sign language. If you went to Nakuru, you would have found something different. If you went to the West, you found something different. And that is why we came down to say that we need a single system of signing that is going to be common to everybody. And so all these experiences were brought together, and that is how we came up with what is called the Kenya Sign Language. In the same way, what we are saying in AAC is that we maintain the symbols in such a way that we shall be able to use the symbols all over, and therefore we shall be able to have our learners sharing their experiences, our people sharing their experiences from a common point of view of a system that they can use together. I think this is what I wanted to say, but I want to say this, that I had indicated that mine was going to be just an introduction about what we have in store in regard to AAC as a society. And of course, I would say in the area of education, because these are the only things you find in the only type of AAC that you find in our curriculum. And therefore, what we are trying to do is whenever we have an opportunity and a group comes together, we can be able to talk to them. And we are ready, and our TOTs are ready to move out and be able to disseminate this information. Like, for instance, I haven't been able to help you know how you make the sentences properly, but at least I have said this is how you make them. I know the board was not very clear, but I am sure if you have an opportunity and we can be able to come together, then we can be able to develop even further. Maybe you show the video so that we can all see some experience of in a classroom situation. I can't hear the sound. Can everybody else hear?
I am from where? Where? Here. So who's here? Where?
Sorry, Mr. Medu, you cannot hear the sound?
No,
Yes.
I can hear you.
Okay, but the
Except from the
video,
video now, I don't know. Can everybody hear?
are we hearing?
Oh, I can see Mama Salvin is saying no sound,
No sound. Okay.
but I
All
can
right.
hear you myself.
Let me start again. It's
From
actually
the
at
video.
100%. I mean at 100. Let's try again.
Yes. Maybe I.
And now?
I'm from here. You asking me where I come from? I am
Yeah, that's
from
okay.
Hill Special School. I'm the head teacher here. You know that? Yes. Yeah. I have no head teacher here, so that is why what we are missing. So I here. He's special. Here. Special. Here. And you? I am from where? Where? Here. So who's the here? Where? Here. Yes, you're also from here because you sleep here. So this is your home until you go back. Sure. From here.
Okay. Can I stop sharing now?
Okay.
Okay.
So that is just some small experience that I wanted to share with you about. Actually, that was the head teacher. The way she's our best trainers in this. And you can see the excitement with the child. Previously, I'm told this child wouldn't say much in class because, of course, the others could perhaps be able to articulate something. He didn't have anything to that he could say. But you can see he's a bright kid. He's telling the head teacher, I belong here. So that is how good AAC can be. But there is something I want to say about it also, that we require some very good assessment before we can say this is where we should begin with a particular child. So we need to get all the data about the child. For instance, if there is no eye contact, then we need to begin from the aspect of eye contact, because it's the most important thing. Because if they can't look at you, it means they can't get a message from you. And that is where we are saying patience, 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 and practice and modeling and so on. And when we talk about autism, because we know there are quite many in the spectrum who have that problem, the eye contact aspect. And it has serious implications on their communication, because if they can't look at you, then of course, it means they won't be telling you a lot of things through body language, or they wouldn't be getting any cues from your body language. So we need to work on that one first before we even go to the boards. And that becomes very key to the caregivers. angalia huyu mtoto kwa macho. And you know, we all begin from there, even right from our infancy. If you are mothers, you can attest to this. But if you don't, if you are the type who will be talking while you don't look at your child, you are going to miss some connection. Kweli ama si kweli? It is true. So we need, even at whatever age, to ensure that although they will have deficits in eye contact, work on it. Be patient. Be loving. One of the things that we have found, I know, affects children and people with autism so much is that when people don't get patient with them, when people shout, you may think that you're shouting at them so that you urge them to do what you want them to do. So the interpretation sometimes comes as I'm being quarreled because there is something that is not right with me. And therefore they start always living in what is called expectancy of failure. That mimi siwezi, I'm different. So speak normally, speak calmly, speak lovingly. If you speak to other children lovingly, this one speak to them even more lovingly because they have a challenge and they need to get that love easily, to get that connection easily. For them, we can't afford to keep shouting. If we shout, we mess a lot. And caregivers, let us be conscious of that. So, so much I would like to say about augmentative and alternative communication. The rest I would say is that it's a wide area. So there are so many gadgets. If you go to the internet, you'll find there are so many gadgets. Some of them are very expensive. Some of them are, very expensive. Very complicated. But for us, we have chosen to begin with this small one so that as we begin, we shall get to know what else shall we need with time. And that is why we are saying we need to work together as a society. And that means that being a society, we are inviting even you people to join us. Thank you, Caroline. Unless I have something I need to clarify about this.
Okay, thank you so much, Mr. David Methu. I'm sure we have learned a lot, and even what is not clear, we will have opportunities. I'm already seeing one of us saying, looking forward to the organizers bringing these as in person in the future so that we can learn what Mr. Methu is presenting. So that is noted. And this is just hopefully a beginning. We'll organize the logistics and let you know. We'd also like as many parents as possible to learn. So I want to open the floor before I ask just a few questions to Mr. Methu, to anyone with a question.
Just before the questions, Caroline.
Okay.
Something I seem to have skipped. I have talked about the use of symbols and the boards and so on. But I didn't talk about that child who is bedridden and perhaps cannot even move a limb. We have another category of issue that we call the partner-assisted scanning. This child or person perhaps hawezi kufanya chochote na mikono yake, so they will not point at any symbol and so on. Even turning their eyes is so difficult. But they have their own way of acknowledging something. Everybody has. Because if, for instance, you ask one who is bedridden and looks like their life is just that, they get hungry. And if you ask them, are you hungry? Would you like to eat? As long as they can make some interpretation, they will try to do something. They will try to tell you yes or no. So we refer to this. We are also saying we need to attend to this so that we don't leave anybody out. Because even that one who is bedridden and cannot be able to make any signs of point at something, then we need to do what is called the partner-assisted scanning. We are calling it scanning because we need to scan for these yeses. Many times we don't scan for them because we let them be there, and we think that the time for feeding is our own time. Timing is their timing for feeding is their timing for this and that. You need to scan, and when you scan, sometimes you kind of encourage them to come out with a yes about a lot of alternatives. Maybe you realize it is 9 o'clock, and this child woke up at 7:30, and you want to ask them, do you feel like you want to go out? You know, they will never tell you. If you leave them, they will just be there the whole day. And many times that is done. So you need to ask them, would you like to go out? Then scan, find out what is their yes, what is their no. It's about meal time. You ask them, would you like to eat a banana? They will have a yes. So once we have got that yes, we have some connection with them. So what we are saying, why it is called partner assisted, it means that it is you who is going to be doing the talking, the wordings, because they don't have speech. But you need to know when they are positive about something, when they are not positive. Are you feeling thirsty? Are you feeling hungry? Are you feeling thirsty? Would you like to go to the toilet? Many of them cannot be able to even say they want to go to the toilet. Maybe we let them just mess themselves up there. And kumbe, would we have got there? Yes. And worked with them as partners. They would have said, yes, now it is my time. I feel I want to visit the washroom. That is partner-assisted scanning. The other one we have is called communication passport. And a communication passport mainly addresses the ability of the child. Even that one who is moving in the streets, to be able to give more information about them for their safety and security. We have had children getting lost. They need something that even if they won't have speech and they have been found 1 kilometer away from home and nobody knows who they are, if they had that small card, it can say, somebody can read out and say, this is so-and-so, and the home area is this. The person we can contact is this. Or it can even contain some of his characteristics. For example, I would like you to, I like people speaking to me from my left, my left here, because that is when I hear. If you speak from the right, I won't hear. Maybe such small information can be there. That is very important. You know, we build the communication passport so that we make the life of the person optimally possible. And the fact that they won't get lost, they won't get hurt, they won't get into discomfort because people don't understand them. And so a communication passport can be used by anybody, any of these, our people, our learners, with disability, as long as they cannot be able to communicate. So that's one thing, one area we are also emphasizing, apart from the partner-assisted scanning. I would have forgotten that.
Thank you very much. Wow, that's quite insightful right there. Thank you. I see comments coming in. One from Maggie, thanks for this, especially for emphasis on patience for an autistic child. Let me just, sorry. Yes. For an autistic child who can hear but doesn't speak, is there any hope for speech? Now the child is around 11 years. I think it's a comment and a question. for an autistic child who can hear but does not speak, is there any hope for speech? Now the child is around 11 years.
Yeah. So, okay. What I would say is that the autistic child or individual has the capacity for learning. It's only that their learning process has challenges in terms of speed, in terms of even the scope, and so on. And because spoken language is learned, we should not at all outrightly, what can we say, outrightly discard somebody as they will never be able to speak. So what I'm saying is that, how does everybody learn to speak? They learn through listening. They hear so that they can be able to speak out. So what I would urge is that for the caregivers and everybody, that we don't tire. I mean, it calls for a lot of effort, but here we are. Let us make every effort we can, that we don't stop talking to them. Because to answer that question, there is still a chance at every point in time for them to be able to speak. Maybe, we talk about delayed language development as a challenge that those with autism have. It is delayed, and delayed means that there is always a possibility at a certain point they will pick up, even if they will begin from their first word at 10 instead of beginning at 2 years. The truth is that they can be able to pick up from whatever age. And therefore, what do we do? Should we ignore them because we are saying they passed the stage at which they could have developed language? No. We should always be conscious of the fact that their point of picking up some aspects of vocabulary, spoken language, and so on is only delayed, and it can come. That should be our motivation. So we keep talking to them, just like we don't stop talking to young children. Talk to them. Because when we keep talking to them, there is that, it gives that opportunity for them to pick out language. At the same time, it mitigates or it helps their socialization. Like we were told from the beginning that one of their challenges is socialization. And of course, communication and socialization have implications on their behavior because they get frustrated. That is where the behavior aspect comes in now. Many times we think they are just expressing temper tantrums for nothing, coming from nowhere. That is not so. It is because they are frustrated about something. Should we have done something perhaps better? And mainly it is about attention. Mainly it's about speaking to them. They wouldn't have felt so frustrated. So let us keep talking to them and talk to them normally. Don't shout, like I've said. Talk to them like they can really hear, because you can get cues from their body language if they are responding. Get that eye contact. Don't give up. Don't say they will never pick up. Yes, they can develop. There's a chance they can develop speech. Always there. A chance is always there.
Well, thank you. Thank you for that. I know it has encouraged caregivers right here. Yes. Any other question? You can raise your hand or just ask. Okay. as in case there is any, before we come to a close, we have just 2 or 3 questions, Mr. Medhu. Where can AAC materials, like the communication board you're talking about, where can a parent get them?
We are saying that in the internet you can find so many symbols and so many boards, but we are encouraging that we have common symbols in our country standing for specific vocabulary. And therefore, what we are doing now, we have in an initiative with where we are pursuing with KICD, so that we can start developing communication boards for our schools and for everybody. But in case, as it is now, you need communication boards, we are able to provide them. The ones that I'm saying, the standardized ones that we are talking about. Of course, I'm calling them standardized. We would like them to be developed by KICD so that they go to school, so that even when children are out of school, they can be able to use them. There are special schools, caregiving centers, whatever centers we have that are catering for these children, that they can be able to use them. But the alternative is that we can get these things on the internet. But what it means is that your child will be learning some symbol that we are not using ourselves. And therefore, if they have to communicate with somebody else, it will be on perhaps on a different perspective. But we can be able to provide these boards. And if I wish we could have an opportunity to have the team here, you people who have participated, to be able to get some day or 2 of interaction with our TOTs, so that they will take you through, you practice, so that you know what you'll be doing with the child, and then perhaps we can give you just a few boards to go work with the children.
Okay, thank you for that. I think it's something we'll follow up from here.
Yes,
so that we come up with we come up with a workable solution that can have caregivers who would be interested to learn more on this, have an opportunity to learn from your team. It's something that we shall tell. We'll reach out to every participant when this is ready, and hopefully soon. Yes. Maybe just a comment on a question that was asked earlier. What is your comment on how soon we can start sign language, to a child?
Sign language. For all children with special needs, there's one principle, that intervention should begin as early as possible. That is, immediately the child is diagnosed with that challenge, that disability, then intervention should set off immediately. So you begin with sign language at the earliest possible time. And that includes even AAC. That's what we would encourage. That if they begin with this, get acquainted, familiarized with the symbols as early as possible, then they will be very fluent. You see, the child you have observed in the class is in a learning situation. He hasn't become really very fluent. That was a video that was taken a little early. But once they learn to use them quite often, then you find they get fluent and it becomes very enjoyable. So early intervention is very important. So I cannot talk about the age because it depends on when the child is diagnosed to have this challenge or requiring special needs intervention.
Okay, thank you for that. Mama Selvin, we see your comment. I would really appreciate the opportunity to learn from the team. That is noted. Yes. Lastly, once you learn, once a caregiver learns from the how to use the communication board, can that be transferred to a gadget, for instance? Because we are in the era of technology, and as you rightly put, for some, it might be hard to carry the board everywhere, but can that same skill be used when you're using technology, the iPads and yes.
Oh, yes. You remember I mentioned you could have it on a tablet, even on a phone, of course, with a screen that is relatively large enough for the child to be able to point out the symbols. In actual fact, in further development, the boards have got the symbols coupled with some speech that is spoken out. So that if it is somebody who is using the board and is using it, and this is a child who understands or a person who understands English, then they could have a software that has got the symbols in such a way that when they point or touch the symbols, then the actual word is spoken in English. And in other words, remember I said that the symbols do not stand for any language. I mean, for any particular community also. So if that software can be a software developed in Kiswahili, that it means that the same symbol, because the meaning is the same symbol brings out the word in Kiswahili. Actually, at more developed levels, and I must say last week that one, I was able to speak to somebody who is using a computer. They have a certain software that, technology has really advanced, that now reads the eyes. What are you gazing at? You are gazing at a symbol, and that symbol speaks out. Just looking at it. So because they cannot point, because they don't have, the upper limbs are deformed, then they just look, and then the sentences come out from the screen. So we hope we shall be able to develop all these things.
Okay, thank you. Thank you very much to all, first of all, to Mr. Methu, to Esther, and to all our participants who have been with us today. I think our time is coming to an end for today's session, but we'd like to thank every last one of us for taking the time to come and learn. This is a conversation that we shall engage. And even as we discussed with Mr. Methu, an in-person kind of forum, details we shall provide so that we can give our children that space to be able to express themselves. And you can also know how to handle them. Let's be patient, as we've been told, and we will get there. We will get there. So thank you, Mr. Methu. Do you have a parting shot?
Yeah, so I want to thank you so much, everybody, Caroline and everybody, and particularly Caroline for having made this arrangement. Thank you for the initiative that you have undertaken. And like I said, at some point, I am very passionate about caregivers, parents, and those people who offer service to children or even a youth or adults with disability coming together to be able to forge the best course for them. It is very important because they are very precious people. Some of them are very bright. Sometimes we don't get to know that. because I have had experience of some of them who think about very high level things, including the politics that we are talking every day. But because perhaps they don't have speech, they're there and people think they don't know what is going on. They would like to make a choice like ours. So I want to thank you so much for your initiative. I want to thank you for this forum. And what I can urge you, like we said, let us be resilient, let us be patient with them, and be loving and genuinely loving them. Let us not feel like it is some obligation or duty that we have been given. Let us enjoy in their feeling accommodated. Enjoy in their feeling included. Enjoy in their feeling that they are recognized and somebody is addressing their needs and somebody wants to talk to them, somebody wants to say something to them in whatever way, in whatever system. So I want to thank you so much. Thank you for giving me this opportunity. And I must say, for us, we feel it is our mission to do this. Sorry, perhaps the presentation may have had some hiccups here and there, but we know, I was telling Caroline, we are so young, we haven't done a lot of these things. So we hope to keep on getting better and better. Thank you, and God bless you so much.
Thank you. Thank you, Mr. Med, once again. We appreciate and are privileged to have you just come and facilitate this. Now we'd like to just bring this to an end. And once again, thank you to all of us. We shall share the recording. If you can visit our social media pages, that is LinkedIn, Facebook. These you'll find on YouTube and Twitter. We are gifted gems all across. And especially for this month, every day, there is something to learn about augmentative alternative communication. So please visit, see much more. What is there? You will learn something. It's a tip every day. So we're going to finish with a word of prayer, and hopefully we'll see you next month as we discuss something else. So I just want us to let us pray. Let us pray. We thank you, Lord, for bringing us to this point. Thank you for allowing us to learn together. And we pray that you will help us to be able to understand and even conceptualize how we can help our children have functional communication. Bless our panelists, bless our participants, and even as we disperse, may you be with us. In Jesus' name we pray. Amen. Amen.
Thank you.
So, goodbye to every last one of us. See you next month, and we'll let you know once we've organized for the in-person training.
Thank you so much.
Okay.